This video production is a planetary education project of Life Celebrating Health. We feel that our responsibility is not only to treat people, but to educate the public in what we do. And so in preparing these video lectures, we have to warn you about the FBI stuff, and you better not make any copies and all that, and then tell you to ignore all that FBI stuff. Because what we'd like you to do is to share this widely, make copies on your computer, get copies from the office. The more people who know that they have options. So our website is www.healthchoicesnow.com. Because if you don't know that you have health choices now, you don't have any. Today we're going to talk about the 3 key issues for all aging Americans. If you were to raise your hand, you would be one of those. If you didn't raise your hand, you're on the way out. Sorry, but that's true. One of the key issues, and perhaps one of the most distressing ones facing us, is diabetes. Diabetes is increasingly common, increasingly virulent. It really can be a nasty illness and happening at much younger ages. Another one is thyroid problems. We have generations of people who have not had adequate thyroid in their development. When I say generations, that means when they were developing as babies before they were born, their mothers had not enough thyroid in order to encourage natural and normal development. Well, now wait a minute. That means that they start out already behind the 8 ball, not able to get ahead in this life, not able to develop fully and normally and naturally. And if you fall into that category, you're one of the dozens of millions of Americans who is swimming around in that sea, because our doctors have done us a grave disservice with regard to thyroid disease. And then another issue is with regard to the sex hormones. Now, you know, this is a topic that used to be taboo. It is now a topic about which there's a great deal of interest, because as we have understood how hormones work, we really have begun to understand how they slow the process of aging and our decline in function, which is the most important contribution that they make to our health. So, let's deal first with the topic of diabetes. There are a number of myths that surround each of these illness patterns, so we're going to discuss the 3 myths that are key about diabetes. When I talk about myths, it's what everybody agrees is true, but it's false. When I say it's false, it's not just an opinion. There are actually scientific studies that show that these myths actually deserve debunking because they simply aren't true. Isn't this a problem, something to struggle with? If most of the medical community and virtually all of the patients think something is true about a particular illness or its treatment, and it's actually false, we've been duped. Now, I wouldn't suggest that we've been duped by the pharmaceutical companies. I wouldn't suggest that we've been duped by the lobbyists who have lobbied our government agencies to restrict information and treatment availability, and I wouldn't suggest that the state medical boards encourage a particular line of medical treatment rather than an alternative to that. But gee, we got duped somewhere along the way. Maybe it was by our coach in health class. Maybe it was by the teachers who directed us with regard to what to read. Certainly I can tell you that's how doctors learn, is we are invited to read particular materials in medical school, and that's where we form our opinions. You have to remember that if what you read is what you believe, you better be reading the truth. So when we talk about the first myth about diabetes, it is that if you've got it, you keep it. In other words, if you're a diabetic, then you're always a diabetic. So you want to avoid being diagnosed as a diabetic because, well, that means something serious for your future. And indeed, what I have spent a career doing is debunking this myth. I learned to manage diabetes in 1976 at the National Institutes of Health in Washington, D.C. I was there as a senior medical student and studying hematology oncology, that's cancer and blood diseases, and we were consulting on a patient in the diabetic ward, the endocrinology unit. This fellow had been on insulin since 1931. He was with the State Department. He traveled around the world, and everywhere he traveled, he asked for who is a reasonable doctor I can deal with here. And they would send him to an internist, and that means a specialist in internal medicine, who is often the one who takes care of diabetes. And he would say, I need your help because whatever I need in terms of testing or treatment supplies, I need you to just write the prescriptions. But in the meantime, what I want you to do is to listen very carefully to me, because I will teach you how to manage diabetes. Now, this gentleman was one of those rare birds who had the diabetes that never produced insulin. And it was a surprising thing that he actually was able to do as well as he was, because when he was young in 1931, he was started on insulin, which had just been discovered around 1924. Now, before then, we didn't know what diabetes was. We didn't know how to manage it. What we know now is that the scourge of diabetes is not so much the people who are born with it, which is called type 1 diabetes, but rather the people who develop it later in life, or what's called adult onset diabetes, or type 2. Now, type 2 diabetes is the one that we get as we get older and heavier. Not everybody gets heavier, but most of us have the issue as we add on weight, we change our metabolism. We're going to talk about that later in the seminar this morning. But what you have to understand is, just because we carry the diagnosis of type 2 diabetes, it is not the same as type 1. Type 1, there is a genetic or infectious deficiency in your pancreas. You don't make insulin. Type 2 is a completely different mechanism, and you can make insulin. So the type 2 folks, this is a myth. If you've got it, you keep it. We actually change this routinely in compliant patients. Myth number 2, the FBS, or fasting blood sugar, matters, or it matters a lot, because that's the only blood sugar test that most patients actually take. They get up in the morning, they test their fasting blood sugar. If it's good, that solves the problem. The only issue is, this is where the misunderstanding comes with their doctors transmitted to the patients. What about your blood sugar through the other hours of the day, especially as you challenge your system by eating food? When you eat food, your body responds by making insulin. So does it respond well enough? Does it respond soon enough? What about the response early in the day when you haven't made much insulin overnight, compared to the response later in the day when you've been making insulin repeatedly after meals? And indeed, the fasting blood sugar means very, very little with regard to control of diabetes. Why is control so important? Because your health totally depends on it. Higher blood sugars and you rust the inside of your blood vessels. When I say rust, that means scratch and scar them. They create blockage patterns. This is a very simplistic explanation, but imagine that if you're blocking your blood vessels, you start to lose function of your body parts, and then you start losing your body parts. This is why diabetics lose toes, feet, legs, fingers and hands, and so on. One of the saddest patients I was ever consulted on was down at 12 Oaks Hospital, and the family absolutely went berserk and insisted that I come down as a consultant, because they had heard that there were treatments we did that could dramatically reverse the diabetes that their mother was suffering with. Now, they lobbied quite heavily for me to come down there, since I was not a member on staff. And when the doctor's staff in medical records found out that there was a note in the chart from a doctor not on staff, they went berserk. That, of course, didn't bother me since I was already long gone. But what they were concerned about was this lady who was lying helplessly in bed, losing circulation so much in her legs that they wanted to amputate her feet and her legs below the knees. My consult note was proceed with the expected surgery. There was no way to save this woman because she waited till late. And what's the problem with mythology? If you hang on to a myth and keep believing it and lead your life by the standards of the myth, you end up too late to actually respond to what's true and what's real. So the mythology that you might have of normal fasting blood sugar for years on end does not mean your diabetes is in control. If it's not in control, you risk losing your feet. Very important to understand. Myth number 3. Hemoglobin A1C, which is also called glycohemoglobin, can be close and still be okay. Now when we talk about close, 6 is kind of the number that is generally looked at by doctors. We want it below 6 to indicate good diabetes control. We want it above 6 to show that you are out of control. And this is a measurement over the past 3 months of how high your blood sugars have generally been. Now there's also another test called fructosamine, and that one is within the last 3 weeks. So we can have an A1C that's elevated because you were in good control over the 3 months, but a fructosamine that's too high because you kind of went on a binge the last 3 weeks. You might imagine that it's the other way around as well, that you can have a normal hemoglobin A1C, an abnormal A1C, because you've been kind of eating wrongly for most of 3 months, but your fructosamine in the last 3 weeks can show you really clamped down on an anti-diabetic diet. Again, another mythology that we'll talk about. But the point is very simple. A1C does not mean close is good enough. It's kind of like driving down the highway. You see the exit for the place you want to go, and you were close in making it onto the exit. You get that? Close doesn't count. You've got to be on the exit, not careening across the median and such like that. So driving is just as important in being precise as A1C is important in being precise in understanding, in fructosamine, in understanding how the diabetes is under control, because it matters. Let's talk briefly about the mythologies of thyroid control. How many people have friends who are on thyroid? Should be just about everybody's hands go up, okay? Isn't that an interesting phenomenon? Let's talk about 3 myths about thyroid control. Myth number 1, your thyroid blood tests matter. Well, wait a minute. Shouldn't you get your blood tests if you have a thyroid problem? Sure you should. Should you rely on them? Not for much. Why? Because those tests are basically to show us whether you have a thyroid disease. We're more interested in the thyroid diseases where they're up, because that can cause things like thyroid storm, where you can actually challenge your heart. You put yourself at higher risk for a heart attack. However, thyroid that's very low also gives information, because if you're low on thyroid hormone, you're at a higher risk for developing heart disease. Now that's not new information. Rhoda Barnes published that in 1976. Do you think that many of our doctors absolutely recall that information? Well, the real question is whether they were ever shown that information before, because you have to remember the magic of medical school is we start with patients who are called first-year medical students, and we end up with doctors as they graduate from their 4th year. And all that information in between has been selected for them by medical professors. Now, the professors do a decent job of transferring the information. The question is whether the information they have is an actual reflection of the true situation. So, given this, your thyroid blood tests matter is just a myth. And what happens is doctors constantly test for thyroid, and I believe interpret them quite differently than I do, because I think what I do reflects how you feel much better. Myth number 2, your thyroid can be close and be okay. Close counts in horseshoes, in hand grenades. With your thyroid, you have to remember why thyroid matters. Thyroid is your thermostat. It regulates the heat inside your body. Now, the heat is related to the chemical events, the processes going on. And we call those processes metabolism. When people say, you know, that's a big word, what does metabolism mean? It means all the things you do when you do all the things you do on the inside. It's the whole ball of wax. It's the things you make, it's the things you use, it's the things you break down. Now, if the heat is lower, you do all those things slower. If the heat is up toward normal, you do them at a normal rate. How many people feel kind of slow when they get up in the morning? How many people feel kind of slow at the end of the day? And how about if that thyroid is not quite adjusted right? Well, that's your biochemistry. And that metabolism on the inside is directly related, just like the thermostat in your house directly controls how you do everything in every room of your house. Flip your thermostat all the way down, you start adding clothes and gloves and such, you're inefficient in every room of your house. Flip your thermostat all the way up, you're trying to fan yourself instead of do the jobs you want to do because it's uncomfortable in every room of your house. So think of your thyroid as the thermostat controlling the functions in every organ of your body as to whether that is warm enough or too cool or too hot. Now, warm enough is the ideal, so the thyroid being close isn't ideal. And what we're after is finding that ideal for each person, which is going to be close to a set point. But not everybody needs to be perfect, because what if you work perfectly fine with the numbers just a little bit off? That's fine. We're not worried about the numbers so much as how you're working. If we try and reset the numbers, and we sometimes do, and you feel worse, that's not the right thing for you. So remember that you are a different person than someone else, and how you feel is the most important part of how your health will be. Myth number 3, synthetic thyroid is better than natural thyroid. Now this one you may have heard. This one is what most doctors say. And in fact, they want to have purified chemical compounds of everything. My only problem with this, there's a wonderful example that I learned 30-some years ago when I was first getting into this kind of advanced medical care, and that is that if you take crystalline vitamin C, it works differently than natural vitamin C. And there are reasons why you would use the crystalline and reasons why you would use the natural. We should all be getting natural things every day in our diet in terms of foods and vitamins and such. But we use crystalline things for specific treatment purposes. Well, it's the same thing. Thyroid is a natural hormone. We don't normally get it in our diet, but crystalline synthetic thyroid looks different than natural thyroid. The chemistry does not have all these, I call them dirty things hanging on. In vitamin C, for instance, the crystal looks very much like a wagon wheel. In vitamin C that's natural, it looks like a wagon wheel with all sorts of stuff hanging all over it. And all those stuffs hanging all over it, the bioflavonoid compounds and other activators, make your vitamin C wonderful for the job it's supposed to do on the inside. So when you realize that natural thyroid can have different effects, even though it's the, quote, same dosage as the synthetic, you begin to realize that what you're trying to do is repeat the natural process on the inside. You're trying to duplicate the natural process, not just add a specific dosage of a chemical form of thyroid. Now, when we talk about the sex hormones, there are other myths that we have to consider. And when we consider these, we have to realize that we are talking about other fundamental settings similar to thyroid inside. They are responsible for setting body tone, energy, strength, endurance, and so on. Myth number one with sex hormones: you no longer have sex, so you no longer need hormones. And indeed, that myth has been perpetuated for years until we had a compound come along called Premarin. Now, Premarin was titled from the actual substance that was derived from pregnant mares, Premarin. And Premarin was simply an estrogen compound readily available from pregnant mares, and sure enough, it had a wonderful effect of calming a lot of the symptoms associated with female menopause. Now, the only problem is, and the Premarin study that was released in 2003 showed this quite clearly, it causes cancer. Well, that's an oops, okay? That's an oops that I was concerned about back in the 1980s when I learned how to manage hormones. So in the 1980s, we did a lot of different things tinkering with the system. And then in the early 1990s, natural bioidentical hormones began to come along, and we were able to dramatically fine-tune how we did hormone therapy. But what we were doing it with is people who come in feeling tired, people who come in feeling blah, malaise, just not right, not like they used to feel, not as enthusiastic as they used to feel. Their life had turned more gray, like a black and white television set, instead of vivid colors like we have now on the flat panel TVs. Well, their life used to be vivid color, and as they are fading, they're questioning why. And it turns out in a number of situations, it's just because your hormones are out of balance. Or as people say, but I'm not planning to have any more children, so I don't need to worry about my hormone balance. And the answer is only if you want to lead a much more vivid life. Only if you want to have vibrant, good health, because all of your systems are responding to these hormones circulating around inside you, not just the baby-making part. Now, it only applies to women, right? No. Another myth there. Men have the same situation called menopause, okay, for lack of a better term. The idea is very simple, that as we pass into our older adult years, we still want to maintain the vim and vigor and strength and muscle tone and bone mass and such that hormones deliver for us. So when we talk about no longer having sex, no longer needing hormones, that is a deadly myth. It will provoke many more problems for you. Myth number two: all hormones are pretty much the same. I can give you an example on that. People come in and they've seen a newbie specialist, went to a weekend seminar and is now an expert in hormones. Well, they're on Biest and progesterone. And you go, great, so which Biest are you on? Well, I'm on Biest. Well, which Biest? Well, I'm on 0.6 and 2.0 or whatever. And I go, okay, but which Biest are you on? And the reason I say that is because there's 3 estrogen hormones. And we nickname them E1, E2, E3, or estrone, estradiol, estriol. Now, the question is, if there's 3 hormones, and you're on a combination of 2 called Biest, like bicycle, 2 wheels, okay? So Biest means 2 estrogens. My question is, which 2? Because if there's 3 hormones, and that matters, then which 2 are you on? And most often, they're on one of the ones that I don't like very much because of the side effect potential. In other words, the one that is most commonly found in Premarin. So the hormones are not pretty much the same. Also, you have to realize that hormones come in different flavors, not just estrogen and progesterone and testosterone, but DHEA and pregnenolone and oxytocin and a few others that are available or have impact into the system. When I say impact, thyroid hormone dramatically affects how well your sex hormones are behaving inside. So if you start to look at this, you realize that we've got a serious problem if we misunderstand the mythology. The mythology will lead us down the wrong track. And one of those wrong tracks is that sex hormones cause cancer. You might have heard that older men shouldn't take testosterone because it creates prostate cancer. And my question is, if older men get prostate cancer because their testosterone is too high, why don't younger men whose testosterone is higher get prostate cancer? And the answer is because prostate cancer occurs as your testosterone comes down, and then if you unknowingly start testosterone at that time, you can increase the growth of that already present prostate cancer. Now, does the same thing happen for women with ovarian cancer? The studies are not as clear. However, sex hormones do cause cancer in very specific instances. One of the ones that I talked with you about is unopposed estrogen, and that was what the Premarin problem was, is that people would just take a Premarin tablet, it's unopposed, there's no other hormone being balanced with it, and that has a tendency to create either breast cancer, ovary cancer, uterine cancer, and so on. So, doing a defined balance is what protects the people who take outside hormones to balance their inside structures and metabolism. So sex hormones causing cancer, debunk that myth. It just doesn't work that way. Low hormones probably cause cancer much more worrisome than anything else. So what are your choices? If you don't know you have any choices, guess what? You don't have any. That's why we call the website healthchoicesnow.com, because if you don't know you have health choices now, you just go along with whatever choice your doctor recommends for you. My thought is that you ought to think about the choices that you have for the illnesses that you worry about. In other words, yours or the ones that you don't want to get. So when we refer first to diabetes, step one is to learn the foods that help and hurt your blood sugars. Help and hurt. There are some foods that can dramatically lower your blood sugars. Example, fiber foods. The more foods you have with fiber in them, the better your blood sugar can be. What about foods that have sugar in them? Well, just ask the ADA, the American Diabetic Association, because they'll tell you that it's okay to eat sugar foods, and we'll have an exchange here. You can eat this sugar food, and that counts for 2 of those sugars or 1 of those starches or whatever, and they have all these things. The ADA diet, in my estimation, you have to be very careful when you criticize the medical establishment, because then they'll say, see, you're touting a whole different philosophy and you're wrong. But in my professional opinion, the ADA diet has worked dramatically less well for patients that I have seen in a career spanning 33 years of private practice, and that doesn't count my training. Now, why did I stop ordering the ADA diet when I went into private practice? Because I wanted my patients to live longer, feel better, and have smoother diabetic control. So learning the foods that help. Now, that's kind of a trick statement. The reason I say that is because sometimes you have food allergies that will provoke your food intolerances on the inside. The metabolism will change, and you can actually have blood sugar responses to eating foods that aggravate your biochemistry on the inside. So if we have difficulty balancing your blood sugars, we start looking for other things. What about people who have celiac sprue or celiac disease? That means that you react to the proteins in wheat. And if you do that, then anytime you eat wheat foods or cousins to wheat foods, other grains, you can aggravate things inside the lining in your gut. Now, there's various kinds of intolerances, and they vary from person to person, and sometimes the blood tests will show them and sometimes not. But the important thing is that's an unknown or secret problem that unless someone identifies it for you, your chance of figuring it out is only that when I eat this I feel worse or my blood sugar gets worse. But you will only figure out your blood sugar getting worse if you're taking the tests. And that's another thing that we'll be talking about. Learn what your blood sugar pattern means. So when I say pattern, people think, well, you know, it's normally below 130 in the morning. And my answer is, and at noon? Well, I don't know. Because remember we talked about fasting blood sugar, FBS. The problem with fasting blood sugar is that's not your noon blood sugar, or the sugar just before you have supper at night, or the sugar level in your blood just as you're going to bed. Because that pattern is what tells us how well your diabetes is behaving and where we need to put in extra treatment attention. So the blood sugar pattern means taking your blood sugars 4 times a day. And patients go 4 times a day? And the answer is yes, but generally only 2 or 3 days a week. That's for people who are out of control. Once they're in control, normally it's just 1 or 2 days a week. So even if you were taking it 2 days a week, 4 times a day, that's only 8 blood sugar sticks. Now remember, if you're doing it every morning, that's 7 and still doesn't help me to figure out how to help your blood sugar control. But 8 in a week, 2 days in which you do it 4 times a day, is dramatic information for me to help manage your blood sugars. So learning that pattern is exceptionally important because it's different for every single person. And everybody gets a little different manipulation on their program. What about choosing a program designed to reduce your need for medications? That's an important step because, you know, the myth that once you get diabetes, you keep it. What about the idea once you get started on medications, you're stuck on them? The answer is no. We routinely get people on lower dosages of their blood sugar medication by mouth. Often we get people on lower doses of their insulin medication that they're injecting. Oh, I might add, we don't do it by using things like Avandia. Do you know why I say that? Because the feds, the Food and Drug Administration, have just put Avandia on the black box list, which means that just under the name in the information sheet is this black box that warns you it's been associated with severe side effects, including death. Now, for those of you who say, well, I want to avoid those medications, I might warn you that all of the anti-inflammatory medications that are commonly used with severe arthritis carry a black box warning because people die from those medications as well. You probably pop 2 in the morning and go about your day feeling more comfortable without realizing you're taking that kind of risk. But Avandia is one of the drugs that I listed in the bad drugs list from a talk that I gave last fall, and said that, you know, it's already in your medicine cabinet, and this is before the feds had put the black box warning on it, because you could see by reading the medical literature where that was going. It was getting worse. So with the diabetes steps, learn the foods that matter for you, learn how the pattern of your blood sugars affects how well you're doing and how we have to change it, and learn to reduce the medications that you're on, because fewer medications is fewer side effects, much more natural control in your system. So what if we turn our attention to thyroid? The step 1 for thyroid is learn how your body feels when your thyroid is correctly adjusted. People go, well, I feel better. Yeah, I understand that, but we really try to get much more precise in terms of the side effects that people have when it's too much and the lack of improvement that they have when it's too little. And so we have extensive questionnaires, or as my patients go, not another form. The reason for another form is very simple. We need information about you, and this is a very efficient way to gather it You get the opportunity to think about whether this is a problem for me when I'm looking at this list of things, and you go, you know, it really is. You get to circle it. When I look at the pattern on your forms, I get a tremendous amount of information about how you're really feeling on the inside. Or as I ask my 93-year-old dad, how are you feeling today? I'm feeling good. And I go, so now tell me details. I want to go through the various systems. Have you been short of breath today? Did you have any other problems? Did you go on your walk? How did that feel? Because I want details about what's operating inside him. He's 2,000 miles away. Well, patients have the opportunity to have me do eyes on and hands on, and I get forms that tell me what's really going on. Because patients don't always understand that these 2 or 3 nuisance problems that you're having are actually thyroid related. And if I just tinker with your thyroid a little bit, maybe we can make those go away instead of having you have lingering things you've just come to accept in your life as just part of your life. So the whole point is to learn how your body feels, because that's the way we want you to feel for the rest of your life. Now, one of the things we warn people is you've got to watch for changes in your other medications as your thyroid balances. Remember, I said that in 1976, Dr. Barnes identified low thyroid as associated with a higher risk for heart disease. Well, you wouldn't normally just think of that off the top of your head, but you also wouldn't think that other medications to correct other body systems might be over-medicating you as your thyroid becomes balanced. So what we want to do is reduce other medications and watch how these other body systems are improving as we get your thyroid much better in balance. Balance is always the key. In biology, you don't want to be too tall or too short, too fat or too skinny, too whatever or too little whatever. Because biology is built on a balance, and the closer you are to an ideal, the better that works for you. You want to be optimum in the middle rather than too much either side. Step 3 with regard to thyroid, insist on being an active partner in balancing your thyroid hormones. What does that really mean? It means that I'm trying to guesstimate how best to adjust your thyroid. But I can't feel what you can feel. I can do tests. We can have you do temperatures. We can have you do iodine assessments and so on. But really what it comes down to is when you felt better on that last dosage we were doing, you're becoming an active partner. You will not get an argument out of me, but your blood test looks better. You will get an argument out of me, gosh, I need to figure out how we get your blood test better while you're feeling better on that lower dosage. So what else is interfering with how we look at this pattern? How do we best take you as an individual, as a particular person, as a special person? When people say, well, isn't it pretty much the same? Well, let me give you this example. There's 300 million closets in America. No two are identical. Everybody has different sizes, everybody has different clothes, different patterns, different colors, different preferences. If we can't even get your clothes to match up, how do you expect we get your metabolism, which is uniquely genetic and developmental to you? In other words, there's no way to duplicate all the experiences you've had. Even identical twins are different because their exposure after the genetics is completely different. And how they work and how they win are different, so how you work and how you win are different. So with regard to thyroid, learn how you feel when it's balanced, watch for changes in other illness issues and medications, and be a partner in how you actually feel to make your thyroid hormones best. We're after your balance and not anything else. And again, when we say balance, we're talking about sex hormones. And step 1 in dealing with that is to learn how your body feels when your hormones are correctly adjusted. Now, what that means is, and when I tell women, they say, well, how will we know if I'm doing okay with my hormone balance? And I go, how did you feel in your 20s when your hormones were perfect and you were great? Well, I felt wonderful. I go, that's how we'll know. We're aiming for that. We're not aiming for any sort of arbitrary sensation or set point or anything. We're aiming for what felt right for you, because that'll be different than what feels right for other women. We have a complicated, I'll just warn you, complicated hormone program because your body's hormone balance is complicated. You go through phases during your cycle each month, ups and downs, different hormones, ups and downs. And you know what? When the women do it and start feeling better, you know how easy it is for them to do those phases after that? Those are not complicated steps anymore. Those become second nature because they feel so good. So learn how your body feels is absolutely critical. Also, increasing your activities as your sex hormones become more balanced. People who say, you know, I've never really felt like exercising very much. My famous saying is, if I had to jog every day, I'd pay a little kid to do it for me. But increasing your activities, going to the gym, just starting walking, just doing stretching exercises, doing things that use your body, because as we get older, we not only lose muscle tone, we start rusting in our joints, we start thickening in our body, our fluid loads change, and so on. As your sex hormones come into balance, you should expect lots of performance issues to improve. And yes, we're talking about sexual performance issues. There's no reason that sexual performance not to be all the way through till the end of life. And that means feeling good. Insist on being an active partner in balancing your sex hormones, because once again, I can only guesstimate what's likely to work for you. And I tell people that you need to learn to bitch, moan, and groan if you come into my practice, because that's the only way I'm going to figure out what's going on with you. People go, well, you know, I'm not really much of a complainer. I know, that's why I'm inviting you to, because people go, well, I don't want to bother the doctor with something. Well, then I'm assuming everything is just great for you. Well, I don't really want to tell you something every time something goes, well, then don't tell me every time, tell me every other time. But the point is, let me know what's working with what you're doing, what's not working with what you're doing, and let's move everything into the working category. So the idea is to customize it for you. Once we have that done, I don't ever have to worry about you. I know that there are some clinics who say, well, you come in here and you can spend a few $1,000s and we'll balance your hormones. And the answer is, why? We've been doing that so long, that's just part of the program. And if someone's in there and says, well, you know, I'd also like to get my hormones balanced and stuff, we just do the appropriate checks, get the appropriate records from the gynecologist and such, make sure that what we're doing is going to be safe for you. Safe is always our first consideration with anything we do. Second is effectiveness. There's no reason to do anything that's safe but doesn't work. So do what's safe and does work. And then third is what's convenient and easy for you to do in producing these results, and how readily can you follow the program, and then how much does it cost. We fiddle with all of these factors after we have safe and effective on board, but you have to be the partner in helping us out with that. So with regard to sex hormone balance, learn how you feel when it's balanced, increase your activities, because moving is life. How do you tell what's alive and what's not? What's alive is moving. Think about it. Even the trees are moving. They're growing, okay? So what's not alive, like stones and roads and houses and such, they're not alive. So increase your activities as part of your life and be an active partner in balancing your hormones. So these are three critical issues that have gone on for people for too long: diabetes, thyroid, and sex hormones. And you are the most important person in your healthcare program, so you have to remember to take charge of your health and your life. If you learn to do that, you become much more satisfied, and we'd like you to let us know how we can be of help. We invite you to dial 1-800-FIX-PAIN. That will get you attached to us. We're in Humble, and that makes sense. Our website is healthchoicesnow.com. Would you like for me to address more issues with regard to your well-being? Good. I got one nod, and I took that one to mean for the rest of everybody. So how about if we talk about arthritis? Would you be interested? Good. Digestive problems? Okay, we can talk about that. How about heart and artery diseases? Good. So we'll talk about those as well. Let's start with arthritis, since that's the common degenerative disease. As we get older, we've injured ourselves and we start having issues with our joints, and Even people who say, well, I never really did an injury are having joint problems. So myth number 1, pains require drugs to help arthritis. Actually, no, not so. But if you believe the commercials on TV, I must be all wrong, because those commercials definitely tell you that you can take 2 of these pills, 8 of these pills, 12 of these pills. Wait a minute, where's the no pills option? Okay? Because all those pills are drugs that are called anti-inflammatories. In year 1 of medical school, we learn that inflammation is the first step in healing and repair. In year 2, we learn how that biochemistry works with regard to various diseases. In year 3, we learn how to prescribe anti-inflammation drugs. And you're supposed to go, how do you hold both of those ideas in your brain at the same time? And the answer is that on the clinical wards, they tell you, forget what you learned, we're going to teach you how to take care of patients. Oh, it's a way of taking care of them, all right. Because if you stop the healing and repair, you don't get healing and repair. So you constantly need to take the medications to treat the pains, because they won't go away. Now, does that make sense? Yes, if you're a drug manufacturer, okay? And yes, if you're a doctor monitoring those drugs, okay? One of the famous drugs, one of the best early drugs that came out, because most of the drugs in the 50s, 60s, 70s were horrible drugs in terms of side effects for arthritis. So about the time of the 1980s, as I was going into practice, there was this new drug came out called naproxen. And naproxen was wonderful. I mean, this fellow came in his early 50s, and I put him on his naproxen, and this, thank goodness, totally obliterated his pains. He was absolutely thrilled. That is, until they admitted him into the intensive care unit, called me across the street to the hospital, and he bled to death in front of me. We could not get enough blood into him to stabilize his blood pressure to take him to surgery 80 feet down the hall. Now, when I say we couldn't get enough blood, I mean we had other hospitals sending us units of blood just in his type. Don't worry, we won't even cross-match it. Send those by lights and siren. We need blood now. And he bled to death in front of me in his early 50s. Now, you can still get that drug, naproxen. You would think that, it's going to have to carry a black box warning and everything like that. Oh, did I mention you can get it over the counter? It's called Aleve. But if you listen to the advertisements for Aleve, it says it's safe. And yet we know that several thousand people die every year from aspirin and the other NSAIDs, or non-steroidal anti-inflammatory drugs. And when I say from aspirin, because aspirin is one of those drugs. Now, baby aspirin is associated with a much safer risk pattern. But once you pass 2 baby aspirin a day, you are already into the side effect pattern. And how many aspirin do people who have arthritis take? Well, they'll take 15, 20 aspirins a day. Or just 2 Aleve, right? 2 Aleve is 1 naproxen. Okay, and we used to prescribe naproxen as 1 twice a day or 3 times a day, depending on if you needed for your pains. Now, what if there are other ways to get around your pain? Would that be worth knowing? And indeed it would. And so we look for the biochemistry behind the cause of your pains. Some of it is mechanical, some of it is biochemical, and we put the combination together, it's absolutely dramatic. Myth number 2 with regard to arthritis, that surgery is the best choice. The best choice. Why do we believe that? Because we went to see an orthopedic surgeon. And what do orthopedic surgeons do? Surgery. So what they generally first do is say, let's send you to physical therapy and see if you get some relief. Surgical relief is different than physical therapy relief, because surgery takes things out physical therapy just makes things move smoother, unless it doesn't. And what is the long-term result from physical therapy? Not much. Not much. You may delay things for a while, you may feel more comfortable, you get better body mechanics, maybe strengthen some muscles and such. But most of what surgery fixes, physical therapy won't help. So you end up with surgery because you went to see an orthopedic surgeon. Okay, now my specialty is orthopedic medicine. Orthopedic medicine does not use surgery. So if you need surgery, we refer you to the orthopedic surgeons. But orthopedic medicine is a whole different approach where we create inflammation in and around the joints to stimulate the healing and repair. Remember, that's the first step in the process. So we create an inflammation that feels different than the pain that you've been having. Why? Because the pain you've been having is a stuck process. You're in a circuit that just won't get better because you're constantly in pain from what is wrong inside your joint. When we turn on healing pain, that healing inflammation feels different and actually starts improving by rebuilding or reconstructing your joint tissues. So, which would be better? Naturally rebuilding your own tissues or having surgery to take your tissues out? Well, but they could put other things back in. But remember, surgery only takes things out. It's scope and scrape operations, or they go in and they clean it out with an open repair where they've actually cut into your joint, or they replace your joint. But you don't get new you. If they replace your joint, you get new plastic and new steel. You don't get new you. So surgery is always a different procedure than natural repair, which is what we think is really ideal. Now, if I get people in who look really bad, let's say your knee is a crashed concern, or your hip, or something, I say, look, why don't we just ease this along and see if we can keep you functional and reasonably pain-free until you decide to have surgery. Because surgery is always an option you can do, and the longer you wait, the better the surgical technology. Everybody's seen on TV lately about the Dupuis hip appliances that are having a recall, and you're entitled to compensation. Would you rather have compensation or a good functioning hip or knee? I think I'd rather have a good functioning hip or knee and not have the compensation. But the best way to get that is often non-surgical. In other words, natural healing repair. But if you get surgery and it's done later, you get a better result than if it's done earlier. Remember that. It's not always the best choice. What about bone on bone? That's the end result of arthritis, and it always requires surgery. You ever seen anybody with bone on bone arthritis? You ever had a friend with bone on bone? Okay, that's what they get told. If that person can straighten their leg and then bend their leg while they're sitting down, they don't have bone on bone. Why? Because if you had bone on bone, the bones are crashed into each other and it is way too painful to try and bend that leg or straighten that leg. So they still have some sliding surface on the inside. I tell people that if you take a juicy joint like a knee or a hip, what you've got is saran wrap covering on one side of the bone, saran wrap on the other, and cooking oil in between. And that slips and slides just right. And if someone throws sand into the cooking oil, it starts to scrape up the saran wrap. And that's what you see on the x-ray when we talk about bone-on-bone arthritis. You go, we've got to have repair. And I go, did you walk in here? And they go, yes. And I go, did you walk in like Chester on Gunsmoke? And the answer is no, they just kind of walked in, but it was painful. I got that part. But if you can straighten your leg and you can bend your knee, you don't have bone-on-bone arthritis. And generally, the repair that we do can be dramatically effective. You don't have to have surgery most of the time. And again, remember, if the repair is not good enough for you, guess what you can do? Go have surgery. Now, hopefully the surgery works great for you. I had a fellow come in, he's in his 80s. He had had his one knee repaired because it was pretty bad off. And it got infected, which is one of the common surgical side effects. So they took it out, and then they put in another, and then that one wasn't quite aligned right. So they took it out, and put in another. So he has a total of 5 operations to get this knee just right. Problem is, just after the 5th operation, he has a heart attack. Now they won't let him have an operation for the other side because he's got bone-on-bone arthritis. And he actually was pretty close. He was his own rhythm section walking down the hall because it was and that was pretty impressive to me. So I said, well, considering that you can't have surgery, it makes sense to me that we ought to do this other approach. And indeed, we did. And at treatment number 9, he told me that the result of our injections was just about as good as the other side that had been repaired with the knee replacement. So just a thought. What about digestive problems? There's 3 myths to consider about digestive problems. Number 1 is that GERD or reflux disease requires drugs for years. How many people know someone who's been taking medication for that for years? Now here's the problem. They're only approved for 6 to 12 weeks. That's what the FDA said. But now that you can get them over the counter, people take them forever. GERD is gastroesophageal reflux disease. We have a fancy name for everything so we can sound very impressive. All it is acid splashing up from your stomach into your swallowing tube. It does not require drugs, it requires fixing the problem. Is it possible to fix? Sure. Because it turns out there's very simple ways to understand the metabolism that's broken on the inside there. What about constipation? Anybody know anybody who's constipated? You know what you say to the doctors? Well, I'm feeling kind of constipated. Well, how often do you have a bowel movement? Oh, I don't know, probably every 3 or 4 days. Well, that's normal. You're supposed to have 3 or 4 bowel movements a day, 1 with each meal. Okay? That's the way animals do it. That's the way we were built to do it. Be an animal, okay? The concept that constipation is normal is false because it increases the risk for cancer of the colon. It also increases your risk for cancer of the breast and probably increases all other cancers. We just haven't done the studies to look for it. So if that's a myth, maybe we better think about constipation differently. Here's something to really think about. You go to the gastroenterologist because he is a specialist in evaluating gut disease. What does he do as a specialist? He runs a scope down and he runs a scope up. After he's done the x-rays down and the x-rays up. And you know what you get told? This is good. We found a few polyps. We took biopsies and they're normal. We found some GERD and here's your prescription. We found a little stomach ulcer and here's your prescription. That's it. Now, the problem is, that's a myth that those are the best diagnostic tools because we have much better ways of looking into what's going on with your gut. Heart and arteries, myth number 1, drugs, surgery, and exercise are the only choices. Why? Because that's the only choices you're given. Drug, surgery, exercise. The only choices because that's what drug doctors, surgery doctors, and exercise doctors do. In other words, if you want a different choice, you have to go to a different doctor. I love it. Sometimes people will come in to see me and they'll be very excited. They'll hear what I have to offer and how well documented it is that we can help people and such. Then they'll go ask their other doctor, hey, I'm thinking about doing these other treatments. What do you think? Oh, no. No. Wouldn't do that. Would not do that. Does that perpetuate that myth? Absolutely. Because you were just told don't do something else that might work for you. And this is even after we have them talk with patients of ours where it's working for them. Myth number 2, bypass solves blockage problems. Well, I had a bypass and I am all better now. The doctor said I can keep doing whatever I want. He encouraged me to do exercise and rehabilitation and I'll be just fine. How many people do you know who've had a second bypass operation? Why didn't they just do that when they were in there the first time? Oh, because they've developed further blockage after the first bypass. In other words, the bypass didn't solve the blockage disease problems. It only solved that one particular one where it was bypassed. What about the fact when bypasses block off? That doesn't solve a blockage problem. That just creates a new one. How about lowering cholesterol? Reduces heart attacks. Anybody ever hear of Lipitor? Crestor, Zocor, Mevacor, Nevermore. If you're a drug manufacturer, these are absolutely ideal products to have on the market. Did anybody hear the recent report that statins, that's what those drugs are, that statins are a $14 billion a year business, and now real medical doctors are beginning to question whether or not we should be doing this? No kidding, Sherlock. 75% of the people who have a heart attack have absolutely normal blood cholesterol levels. 75, not 7%. They would lead you to believe that we've got to have your cholesterol dramatically lowered or you're going to get in trouble. But in actual fact, we can't afford to have you walking around with normal cholesterol because you're going to get in trouble. We already know that. And my question comes, is this myth killing us? Because the side effects of those statin drugs are dramatic. They interfere majorly with your energy. Now, I'm not talking about, oh, I don't feel too good. No, I'm talking about whether or not you're driving the biochemical processes inside your body, whether your energy to do things on the inside is working. It's dramatically interfered because it blocks CoQ10. Those statin drugs block your bile acid salt so you can't absorb your fatty acid vitamins. They block your hormone production because you make hormones from cholesterol. They block your vitamin D so that you become increasingly osteopenic and then osteoporotic because you're no longer doing anything to protect your bones. And they tell us those statin drugs are safe, and I've given you the short list of important things. Would it be possible that you might have other choices? And I would suggest as we look at arthritis, again, step one is learn the natural ways to reduce your pains. If there are things to do to avoid those drugs, wouldn't it be wise to do them? And you know what people say? I love these answers. That sounds like a lot of work. I'm not sure I have time for that in my life. Okay, then you'll have time for it later. You'll get a long rest later. You'll maybe be able to take care of it then. Or, and I love this one too, well, that costs money. Really? Anybody price these drugs lately? Price the over-the-counter ones. The over-the-counter drugs now are more expensive than the prescription drugs were 20 years ago. Isn't that a kick? So maybe learning all the natural ways to reduce your pains makes a difference. Step two, learn how to avoid surgery and its risks and limitations. Avoiding surgery would be a really high thing on the list. I'll give you an example. Let's just assume that surgery is wonderful. What about the rehabilitation that it takes after surgery? One of my patients who's still an athlete in his late 30s and has now started working with his trainer, he says, you know, after the surgery that I've been through and then the other patients that I've seen, you need to emphasize that you get right on with what you're doing. You still keep going while you're getting treatments. But when you have surgery, you've got months of rehab, you can be on crutches, you can be on limitations and such. What's it worth to lose that time in your life? I said, that's a good point. I'll start talking more about that. Step three, learn that bone on bone does not require surgery unless it does. How do you know that it does? Well, you're not getting improvement with the non-surgical treatment. But what if you are getting around and doing well? People say, how long can I delay having surgery? And I go, how long do you feel good? If you feel good, you can keep delaying it. If you feel good until the day you die, I guess you delayed it completely. And our job is to get you to feel that good. So with regard to arthritis, learn the natural ways of treating it, learn the non-surgical approaches that work, and get a third opinion. If you've seen an orthopedic surgeon and then get a second opinion from another orthopedic surgeon, get a third opinion from an orthopedic medicine specialist who doesn't do the surgery. And I have patients where I come in and I tell them, you need to go have surgery. And they go, no, I came here for what you do. And I go, I understand, but what I do isn't going to work for you. If it's not going to work, why do I even want to start? You're going to be unhappy, I'm going to be unhappy, it's not going to work out. You need surgery. So when I tell people they need surgery, they should remember, I trained in surgery. I like surgery. I love doing surgery. And if you need it, that's what you need. It's not the last choice. If you need surgery, it's the first choice. If you don't need it, it's no choice at all. So when you think about it that way, you start getting a third opinion that matters. What do you do with digestive problems? Learn how to treat GERD and reflux without years of drugs, because those drugs interfere. I'll give you an example. If you have to digest your foods in order to make new people parts, you've got to run food through the stomach blender, which is acid, and the pancreas blender, which is alkaline. These are two different ways of chopping up foods from one end and then another. And you cannot take food parts, absorb them, and rearrange them as people parts unless they go through both blenders. Guess what the GERD drugs do? Stop the acid blender. They effectively interfere. From the moment you start continuously taking those drugs, you are getting older and sicker because you are unable to efficiently repair things inside your body. It's important to learn how to do that. Step 2, treat constipation naturally, but always treat it. Don't ever say, well, that's good enough. Oh, I'm so much better than I was. Oh, I realize I'm not having a bowel movement every day or twice a day, so I'm really okay anyway. Because that's not effective. You've got to keep your elimination system running, or guess what? You'll be what's eliminated. You don't want that. What you want to do is find out how to fix these things so that they work naturally, like they should be working, like they used to work, and you will be dramatically happier. What about seeking function tests rather than scopes and x-rays? We have patients who say, well, shouldn't I get another barominima or upper GI or whatever? Or I'm going to go back to my gastroenterologist, he's going to scope me again. And my question is, how has that done for you so far? You know the definition of insanity, doing the same thing over and over again but expecting a different result. We do tests that tell us how your food is being digested, because that's the whole purpose of a digestive system. And what we look for are the different ways in which food is impacting us. You got to remember, 70% of your immune system lives right here around your gut, because that's the most important challenge that is going to face you. Food is going to come in from the outside, and even though it's inside your gut, that's still outside your body. You haven't let it into your body yet. It's still in a tube that's attached at both ends. So you're looking very seriously at that food, trying to decide, do you like it, do you not like it, are you going to process it or not? There's a lot of activity going on, and we look at the different ways in which you function in order to determine what needs to be changed. And once we have that, you can't see that incidentally on scopes and x-rays. But once we have that, we are dynamite. So remember, with digestive problems, fix the GERD and the reflux, fix the constipation, and choose function tests, because they will tell you how you're working. Oh, patients say, how will I know if I'm doing better? That's the Polish question, okay? That's because I went to medical school in Polish country up there in Cleveland, Ohio. Down here you say, that's the A&M question. The deal is that when you stop having the belly bloating, the pains and discomfort, and when you stop having the constipation or the diarrhea, when you feel good about the way your belly's working, that's how we know we're winning. So, heart and arteries. Step 1, safe, effective heart treatments have been available for over 50 years. We do chelation therapy and nutritional therapy, oxygen support, hormones, and all sorts of other things in order to get you coordinated in better heart and blood vessel function. Safe, effective treatments. Now, when people say, well, my doctor said that doesn't work, then your doctor simply isn't aware. He's not informed. You now have gotten an uninformed opinion. Because if he doesn't know the science behind what has been looked at and documented over the last 50 years, then he's unscientific, which means he's on a par with you. You two are just two patients discussing it, not a doctor and a patient. But when you go to a specialist who's a doctor in this, who knows the literature, and who wants to share it with you. Remember I talked about getting this data disc, the green disc in the blue envelope. Read the book, Lifelong Health. In the chapter that's called Millions Are Still Suffering, we have lots of documentation showing you from the medical literature what's real about safe, effective treatments available for over the last 50 years, and that's chelation therapy, nutrition, oxygen. We've done research on oxygen since 1993. I got a master's in nutrition in 1985 to learn what I'm doing. It's nice to know what you're doing, because if you know what you're doing, you tend to avoid bypasses and stents because they plug up and require repeat surgery. My best patient for stents had stents, 6 weeks later had other stents, 3 months later had other stents, and came to me. Said, I figured out that I can't keep going like this. That's the A&M question. And that was the last set of stents he had, because he started doing our program with chelation therapy, nutrition, oxygen, hormones, and so on. So avoiding these things where possible makes a difference. It turns out, if you really look at the statistics, and if you go into the chapter in the book that I'm talking about, you'll see how important it is. Avoiding these things means you avoid the possibility that they will plug up in the future. Avoid the serious real risks of drugs that lower cholesterol. We talked about the statins. When I talk about them lowering CoQ10, you go, okay, well, I know about CoQ10 and I'll get that from the store and I'll take it. No, that's not the point. It's lowering it, for instance, in your heart cells. In your cells, you have what's called mitochondria, and they are very specific about energy production. They make all the energy that you use. In your regular cells, you have about 600. In heart cells, you have about 2,000, because they can't take 5, smoke them if you got them. They got to keep working all day long, all night long, every minute of every day. If you interfere with CoQ10 there, you create cardiomyopathy or heart illness. And it's not necessarily blockage disease, but you're not as efficient in your heart as you used to be. Very important. There are extreme risks with lowering cholesterol. You need to know about avoiding surgery, avoiding repeat blockage, and avoiding drug risks that are present in many of the treatments that we now prescribe for this. So with regard to arthritis, digestive problems, and heart and arteries, again, you are the most important in your healthcare program. You need to learn to take charge of your healthcare and let us know how we can be of help. Dial 1-800-FIX-PAIN. We keep saying that because I want you to remember when you're talking with somebody, hey, dial 1-800-FIX-PAIN. We're in Humble, about 20 minutes away. How about, should we discuss more health issues? Okay, let's talk about osteoporosis and vitamin D. Osteoporosis happens not just to women, but also to men. And it increases your risk of death because 1 in 6 women will die directly associated with their osteoporosis. They'll break a hip, that's a downward course. They'll have other problems with their backs or whatever. Vitamin D. Oh boy, you've seen about this now in the magazines and in the internet things and such. And the sad news is that most doctors know very little bit about vitamin D because it's actually not a vitamin. It's actually a hormone. But since it got titled a vitamin, we can call it a vitamone. It's a vitamin hormone. Fancy names. Most doctors are very shy to give you very much vitamin D because they've heard about toxicities. Who's heard about vitamin C causing kidney stones? You know that there was only one report in the medical literature years and years ago of a patient who was taking vitamin C who also had kidney stones. Have you ever heard of anybody who's had kidney stones who wasn't taking vitamin C? So is that a causal relationship, the vitamin C caused the kidney stones, or is it a casual relationship? Just so happened they were taking vitamin C. Also, they were a person who got kidney stones. One. And from that one, the mythology has sprung up. Oh, don't take high doses of vitamin C, you'll get kidney stones. Don't take high doses of vitamin D, you'll get sick. And it turns out that's a myth. High doses of vitamin D are required. In fact, they improve your immune system dramatically, lower your risk for heart disease, lower your risk for Alzheimer's and Parkinson's, and so on. What about prostate and PSA? Who knows what the PSA test is? Prostate-specific antigen. There's now some new information. Oh boy, we're just overusing the PSA and it doesn't help survival any at all. That's a myth. Okay? New information that it's a myth now. You've got to get the free PSA test, not the PSA. PSA as a general number is minimally useful. The free tells us what percentage is free or bound in the blood. And that test is an extremely precise one to follow along. and really stops a lot of the testing that would otherwise be done, which tends to be more surgical. You want to avoid that. Prostate cancers, breast cancers. Why do I say the two together? Because it turns out that most things that affect prostate also affect breast. And so, for instance, let me talk to you about, we mentioned thyroid, okay? Iodine is terribly important for thyroid, and we've had 50 years of avoiding the salt because, in the 1950s they said, oh, you better stop eating salt because you get high blood pressure. Well, we added iodine to salt because people were getting goiter on their thyroid. Goiter simply means you got more thyroid trying harder to work harder because you need more thyroid. And now when you take away the iodine because we stopped salting all our foods, but we didn't stop eating peanuts, pretzels, pickles, chips. All those are salted, but they don't have iodine in them. So iodine is low in our tissues, and that's our thyroid. Guess what other tissues concentrate iodine? Breast and prostate. And would you believe that those are tissues that also, incidentally, concentrate vitamin D and such? Would you believe that those tissues are on the rise with cancers? Well, just an incidental, a casual observation. How's that? What about high blood pressure? We dramatically overtreat high blood pressure in lots of patients. Why? Because that's the mythology. In fact, there's a book Jerome Kaufman wrote called Malignant Medical Myths. Fascinating book that actually takes the medical literature and says, look at all these things that are problems because we assume things that aren't true, and then we treat on that basis. High blood pressure is generally overtreated, and incidentally, in a number of patients, we're able to take them off of their medications or dramatically lower them. It's important to lower the side effects of blood pressure medication because it doesn't feel good. How about gum disease and heart attacks? Have you heard that story before? Baylor spent 20-some years looking for viruses and other such things that associate with heart attacks because we know that gingivitis, or periodontal disease as it's called, is associated with an increased risk of heart attacks. Newer information coming out, and it's actually been well developed by one of the professors down at the University of Texas Dental School, Jerry Bocco, has looked at what's called biofilms. Now, biofilms is that kind of feeling that you've got that there's something on your teeth, and that when you really brush and get that clean, that's gone. Well, it's gone on your teeth, but not down in the gum area where your tooth attaches to the bone. That's a biofilm. And good biofilms are great to have, and bad biofilms are not. And that is the connection between gum disease and heart disease. And we are just now discovering how we should think about treating it. This is brand new information, and it's getting a lot of play because it matters. What about an old piece of information? Chronic fatigue syndrome, described at Lake Tahoe in 1980 or so, and it's also related to fibromyalgia. And chronic fatigue syndrome and fibromyalgia are a cluster of symptoms that have several different causes. And it's extremely expensive to suffer with these because your life goes to crap. And there's no other way around it, except for the fact of getting it fixed. And so for each person, we have to figure it out. Same thing with restless legs. They actually have drugs for restless legs now. It's part of the constellation there of the fibromyalgia pattern. And it turns out that nutrition is what fixes things. When I got into this business, I started learning about nutrition after medical school, after surgical training, because they don't teach you about it there. And I began to realize, wait a second, we grew from a little tiny speck of an egg that you couldn't see under a microscope unless you could really hone in on it, to the size that we are now. Which drugs made us grow that big? Not one. It was food, air, and water. Okay? The air didn't contribute much. The water did contribute because it was the biochemical milieu, the place where all the chemistry took place. It was the food. Well, if food parts are good enough to make us and all our systems, why shouldn't they be good enough to repair those systems? And once you cross that line and start thinking about it that way, you're no longer thinking about drugs and diseases. You're thinking about malfunctions and diseases. And if it's a malfunction, let's put in the food parts that repair the function. How about vitamin C and heart disease? Does anybody know that Linus Pauling years ago discovered that high doses of vitamin C And lysine, which is an amino acid, will actually help treat heart disease and blood vessel blockage disease. And he patented that. Do you know why? I love this story. Because his work on vitamin C and colon cancer was ignored. And they, quote, disproved it by picking other kinds of patients, oh, see, the vitamin C didn't work. And that irritated him a lot, so he wrote a letter and said, no, you guys didn't do the same kind of study we did. We showed how colon cancer can get dramatically better with vitamin C, but you chose different kinds of patients. He couldn't get his letter published. There's one person in the history of man who has 2 unshared Nobel Prizes, Linus Pauling, and he couldn't get his letter correcting and challenging that study published in the medical literature. So when he came up with his treatment for heart disease with lysine and vitamin C, he patented it. And he described it in such exquisite detail, you'd have to be the stupidest monkey not to be able to do it. And that way, you know, the patent department never loses a patent. Those are always published and always kept clean. So anybody could go there and always find out what he did. It wouldn't be buried in the medical literature. Smart move. What about peripheral neuropathy? We hear a lot about that, right? Is that people who just don't feel right with their feet and then it starts in their legs and such like that? There's a number of problems associated with that. Disease, illness problems, and nutritional deficiencies. Those need to be addressed from what's causing yours point of view, not given drugs like Neurontin and others that have side effects. I think side effects is the nicest way to say it. What about CoQ10 and heart disease? You've heard about that. CoQ10 is extremely important because our diets have become so minimal in terms of cholesterol. We've gone to low-fat foods. We've gone to cholesterol-blocking drugs. How many people think that eating a low-fat food is healthy for you? How many people have been told, avoid eggs? And for heaven's sakes, if you're going to eat eggs, at least just eat egg whites, don't eat the yolks. That's wrong. It's a myth. It's an error. It's a misunderstanding. Remember, when I went to medical school, I got 4 hours of training in nutrition. That was the most that was offered in any medical school in the country. 4. It's what you're made of. Now, if you really wanted to fix what you're made of by using what you're made of, 4 is not enough. That's why I went on and got a master's degree in nutrition. CoQ10 and heart disease. If we had more CoQ10, vitamin B6, magnesium, a few things like this, we could dramatically lower the heart disease in this country. How about memory loss and dementia? Everybody's concerned with that. It is generally easy to treat early on. Why? Because it's a malfunction in the brain. And all we have to do is figure out what parts are your malfunction and how do we fix that. Parkinson's or early Alzheimer's, you know, these are kinds of things that doctors don't like to see walking into the office unless they're a specialist in neurology, and then they know how to babysit you and give you Aricept and other drugs and all the Parkinson's drugs. We much prefer to work toward reversing these disease problems. Why not? I mean, do you want to have a well-compensated disease or one that you remember you had before? Just think about it. That's just the way it works. Magnesium and heart disease. Turns out that we are dramatically short of magnesium in this country. Why? Because we don't eat magnesium foods. You can eat one of those Arby's roast beef sandwiches for about 1,600 calories and it has virtually zip for magnesium. Or you can eat a salad that has green stuff in it. That's magnesium. All the plants have magnesium. It's called chlorophyll. That's the green part of plants. We don't eat those parts. In fact, we don't eat plants. We just eat processed foods. And that's why we have so much depression and anxiety, because magnesium is associated with that as well. Low magnesium, you get arthritis, heart disease, depression, and anxiety. And we are a low magnesium society. That's why you get to see all these advertisements for depression drugs on the television. And you know what's neat is now they've got it half and half. Half of it is promoting the name of the drug so you'll remember it. The other half is all of the things including this various side effect, including sudden death and suicide. Ask your doctor if this drug is right for you. What do you mean suicide and sudden death? Wait a minute. My doctor's going to tell me that's right for me? Yeah, he'll prescribe it. What about the yeast syndrome? I told you this was our book from Bantam Books, 1986. Now available on ebook type formats so that you can read it on any reader. The yeast syndrome explains basically 1/3 of the illnesses in developed countries. We are a developed country. We are soon to become a third world financial country, but we're at least a developed country. Oh, don't get me started. Oh, you got me started already. But the yeast syndrome is because we eat too much sugars and starches, and we get ourselves in trouble with infections on the inside that nobody ever sees because they're on the inside. And therefore nobody ever treats. You get to go to all the different branches of medicine to deal with all the different branches inside you that are having problems, instead of looking for the root cause, the one thing that's causing it to show up in different places. What about puzzling or frustrating symptoms? Yeah, that's what we take care of. Why? Because it's something that's a malfunction in you. And there's mythologies about whatever your symptoms are, whatever kind of frustrating things you're suffering with, people have a myth about which drug ought to take care of that. I prefer to look for which cause can we find out. Vitamin E and heart disease, gee, you know, that recently there was a study that showed that 50 years of experience with that was wrong. Nope, doesn't help prevent heart disease at all. Of course, it does matter whether you use this form of vitamin E or that form of vitamin E. And natural vitamin E is what works. It's an alcoholic form, not an ester form. But the drug form is an ester. How about ulcerative colitis, Crohn's disease, diverticulitis? Those things matter as well, okay? Eating disorders, those things matter as well. You know, people who've had bulimia, people who've had, various wasting diseases and such, weight loss at an early advanced age and such. Those things matter and can be fixed in many ways. What about fat belly syndrome, or what's called insulin resistance? We've been doing a lot of work on this in the last 4 years and are coming up with some fascinating ideas. It's also a subset of that is called metabolic syndrome, sometimes cardiometabolic. And does that matter? Absolutely yes. Why? Because what we have with this is a change in the fundamental metabolism inside every cell of your body. And that's because they're all responding to insulin in an altered way. There's some neat understandings of that we're coming up with that it's too much fun to look at how the biochemistry works. The older I get, the more fun medicine is. I'm starting to ask the right questions now. What about snoring and sleep apnea? We've done research on that since 1993. There's all these sleep apnea clinics that are opening up now. For only $4,500, we can do your test. We'll give you a discount if you have to pay cash because you don't have, insurance. Our test has been $400 for years. But anyway, there's all these experts out there who want to put you on the scuba device called CPAP. I don't like CPAP. It's awful brutal on lungs. What about asthma or emphysema? Diseases that are brutal on lungs. Asthma is another one of those low magnesium diseases. Emphysema, and amazing how many things we can fix in your lungs. If you want weight loss programs, we developed the Celebration of Healthy Eating in 1984. The Better Body Now program came about 3 years ago. The Better Body Express is what we're introducing in this next month, an HCG-based dietary program. How about erectile dysfunction? Oh, that's again part of the sex hormones issues. So what we want you to think of is that all these kinds of things, whatever it is, are malfunctions in the way your body systems work. PMS, menopause, menopause, all those are fixable illnesses. Why should we walk around suffering with those? And here's one I like, fertility difficulties. When you look at that, it's amazing that in this country, we have 1 couple in 6 who has a problem conceiving a child. And you go, in the richest nation, the most well-fed nation in the history of the planet, 1 in 6 sounds bizarre. And indeed it is, but we are malnourished. Food allergies, lactose intolerance, celiac gut disease, these things are straightforward. They are not complicated. Of course, I do have a little bit of experience, and that's how come the list goes on and on. Natural treatments are available, safe, and effective because I've been studying this for a very long time. Here's the major problem with getting better. Houses, remodeling houses, furnishings, cars, trucks, boats, vacations, rental properties, stocks and bonds. That's what people spend their money on because they want to. And then they hear that you have to pay for treatments to get healthy. And they go, but my doctor takes insurance. Yes, your doctor is an illness doctor. We are a healthy doctor. It's your choice. if you want to be healthy, you can trade off some of these other things. You know, they say the two happiest days in a boat owner's life, the day he bought it and the day he sells it, okay? But in between, it's costing him money that is not providing him better health. Maybe some joy, but I think the greatest joy is better health. So what does each day of suffering cost you? And that's really what you have to look at when you're trying to decide what you want to pay for in life. What should you do today? What would you do if you could feel dramatically better? Now, that's really the deal, is that if that opportunity is available, are you willing to reach out and take it? The reason we can say that what we do works is because we have 33 years of patient successes. So we invite you to challenge us with your problems, because what we do works. And it's time to do what's best for you and your family. Remember that you're not the only one that's suffering if you're not feeling well. They are as well. So let us know how we can be of help. 1-800-FIX-PAIN. Health Choices Now is the website. We encourage you to go visit. We have a new one now, bioidenticalhormonedoctor.com. We invite you to go there as well. So it's been a pleasure having you here today. Thank you so very much.